Everybody quiet in the room, patients here.
Good morning, Rescue 23 coming here with a 23-year-old female motorcycle into the rear end of a truck. Going approximately 70 miles per hour to approximately 120 feet. Road rash to all extremities, 51. Was wearing a helmet. Helmet had a crack in the center of the helmet. We do have the helmet with us. Pupils, left pupil was blown. Initial blood pressure was 70 pal. 2 large bore IVs started and blood pressure maintained at 100. Rapid trauma showed bilateral femur fractures and road rash. Good pupils on all extremities. GCS, initial GCS was 3. Patient intubated on scene, no posturing, anything beforehand, got no response from them.
Any meds required?
No meds required.
Any medical history or blood thinners?
No blood thinners that we know of. The only thing we know is she takes Ambien. She has no allergies that we know of. She has someone riding next to her.
Get in your way.
Happy with the airway.
Got good airway. 16 in the ready. Equal breath sounds. Good tube placement.
Let me step over here just for a second.
We need end time hooked up.
Mostly right-sided by right type of abrasions to the
66.2.
hip, lateral thigh, ankle, and foot.
We have a respiratory therapist.
We'll have respiratory's been paged.
97.7 temp.
7.7 temp.
Labs drawn.
Labs are drawn.
Got a 66.2 with the board weight.
Thank you.
Remove any break.
Exposed the chest, abdomen, and pelvis.
Soft right now, fast exam in progress.
Thank you.
Got a longer one.
I don't think they're still that long.
Do you have a set of vitals?
Give them right now.
Thank you.
Yeah, mine.
Yeah. Patient's 100% being ventilated, end titles 35, 97.7 temp, and a blood pressure's cooking.
Okay. Is there anything else that I should know about this patient? Do you have any other information?
Blood sugar was 119.
Blood sugar is 119. Thank you.
Did 12 liter mouth, 12 liters negative.
Do you know what time the accident happened?
Approximately 45 minutes ago.
45 minutes ago. Okay, thank
Someone
you.
was riding next to her. That's where we got the information from.
Okay. Okay. Excellent. Thank you. You did a great job. Okay. So when you're given trauma report, it's really important to know that when you enter the room, we will ask everybody to quiet down, and you have about 30 to 90 seconds to be very clear about what happened to this patient, what you have found, what you suspect, what treatments you have given, and then you hand the patient off to us. At that point, we take over, but we don't want you to leave the room. When you first enter the room, you'll bring your patient up to the head of the bed. What's different in report for traumas is that you're giving report to the entire room. In this situation, you would be giving report to the doctor standing at the head of the bed.
So we had a 23-year-old female patient involved in a motorcycle.
I'm sorry, I can't hear, and I'm recording over here.
So we had a 23-year-old female patient involved in a motor vehicle crash. Patient
Excellent.
sustained injuries.
So when you're giving report in the trauma room, you have to understand there's probably about 10 people in the room, usually when you walk in, sometimes more depending on what's wrong with the person and how many extra bodies we need to help us. And everybody, despite trying to be quiet, is not. And so we try to quiet down the room, but you have to project. You have to understand that everybody in the room needs to hear what's happening. This includes a pharmacist who will be standing behind over here. The charting nurse, the TRN that stands here at the computer, is actually recording everything that happens in the room. But the physicians and the nurses and the tech standing at the bed also need to know this information. Once that handoff is done and the patient is moved over, the staff here takes over the care of the patient. What happens often is there's more information that you feel is important, and we understand that, but when you come right here, I am unable to see the patient, I'm unable to see the injuries on the patient, and also if you're talking to me here, I'm unable to record the information that the trauma surgeon, the ER physician, TRN2, the nurse tech, the respiratory therapist, they're all talking, and they all have a very specific role in which, an order in which they give me that information for the primary and secondary survey. So once you get done at the bedside, go ahead and go back over there. you've given your report, we may ask you a couple of questions. I'd ask you to come right over here, but maybe step over to this portion, just so that you're just kind of out of the way, but at the same time, don't go far because we might have a few more questions. Generally what will happen then is the primary survey, secondary survey happens, and we'll prepare this person to either go to CAT scan or to go to IR or OR. And right about that time, usually 10 to 12 minutes in, sometimes less, I will ask you, do you have any other information to give me? And I will bring you back over. What happens here is a lot of stuff. People will end up coming over and they're trying to talk to you, and registration's coming to give you their stickers, and everybody's coming to take a sticker. It's too much chaos for this person to record everything that's happening in the room. And again, this information is the state required mandatory information that must be charted and is reported to the state and national levels for trials. It's very important that we capture all of that initial information. So, do you have any other questions or any other things you want to talk about?
I don't think so. I think we
think
covered
that's
it
the
all.
highlight.
Okay.
Yeah.
I would like to say too, and we discussed this, that again, unless you're asked to stay in the room and participate in care, please step back and just kind of stay on the wings. We want you here. We need that information. We might need more from you. However, like in a situation if you were doing chest compressions when the patient arrives, once you hand the patient over while you give a report, we will assume the care, we will take over the compressions, you can finish your cycle and then tell, okay, good, and the other person will say, got it, and they'll start taking over the compression. In cases that are very difficult, I understand it's hard not to get personally attached or have some kind of feelings about it. We always invite you to be part of our debriefing after the situation has completed in this department. Also, you can always come back and speak with somebody like myself or one of the managers here and ask them if they can give us an update on the patient, because we do the same thing. We also have a job to do, just like you did to us. We also have a job to quickly take care of and get them to the right place. And then we also have to do that handoff, so we understand it's a little bit difficult. But at the same time, it's very important that you let us take over, because we all have a role to play in this, unless you're specifically asked to stay in the situation.
Awesome.
Okay?
Well, thank you very much for your
Yeah.
help.
Thank you.